welcome to Narikaa Talkshow. Let's learn together and grow. And today, it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr.Yogesh, who is present here with us, and he will be answering some of our questions regarding today's topic, which is ovarian fallopian tube. So yes, doctor, before jumping to the questions directly, please tell our viewers something about yourself.
Hi everybody, I am Dr. Yogesh Kulkarni. I am the head gynecological cancer surgeon at Kokilaben Dhirubhai Ambani Hospital, and I also specialize in robotic surgery for gynecological cancers. I have been working in the field of gynecological cancers for past 20 years. I have been trained at Tata Memorial Hospital, and for last 14 years I have been working as consultant gynecological cancers at Kokilaben Hospital. Ovarian cancer and fallopian tube cancer are something which is very close to my heart because these are some of the most challenging cases, cancer cases that we treat, and it is absolutely important that everybody is aware of the risk and the symptoms of this cancer.
Thank you, doctor. And doctor, our viewers would like to know at what moment would you say was the moment when you decided to become a doctor?
Oh, I think I have been coming from a family of doctors. My father, my grandfather, my uncles, I think everybody in my family has been a doctor. But I think for me, the moment of reckoning came when I was probably in my 11th standard. I was actually very keen on joining engineering. But at that point of time, I came across when I was visiting my uncle to see some of his patients, and that's the time I realized you can actually impact lives directly by being in medical profession. That's the time I decided that I would be becoming a doctor.
Well, doctor, thank you. And moving on to our questions now. So as the topic itself says, ovarian fallopian tube. So doctor, what exactly is ovarian fallopian tube?
Yeah, see, ovary and fallopian tube and uterus are basically organs that form the female genital tract system. Okay, so the function of ovary is to produce ovas, the ovums which are required for fertility. There are two ovaries in our body hanging alongside the uterus. Fallopian tubes are the channel which carry the ovum from the ovary to the uterus where actually fertilization happens. So there, the important part of fallopian tube is basically a carrier of ovum from ovary to the uterus. Ovary, apart from producing ovas, also produce hormones which are absolutely vital for an overall development of a female. So apart from producing ovas, they also play an important role in overall well-being of a woman.
Thank you, doctor. And doctor, what is ovarian cancer?
Yeah, it's cancer, any cancer. In our body there is a cell cycle where there are equal number of cells produced and there are equal number of cells die, so that the balance is maintained. When this balance is disturbed, when because of some stimulation or because of genetic causes or because of environmental causes, the number of cells produced are more than the number of cells dying, there is a misbalance between the production and the death of cells. So uncontrolled growth of cells basically leads to cancer.
Okay, doctor. And doctor, what causes ovarian fallopian tube cancer?
I think you can't pinpoint a single cause for ovarian fallopian tube cancer, but there are a variety of risk factors that are associated with ovarian and fallopian tube cancers. One of them is infertility. There are late pregnancies. Then there is also certain genetic factors that can lead to an increased risk of ovarian cancer. If you have a strong family history of breast or ovarian cancer, increases your risk of ovarian cancer. There is also some association between hormone replacement therapies and ovarian cancer, but you can't pinpoint one specific cause for ovary or fallopian tube cancer.
Okay, doctor, as you discussed about the risk factors of ovarian fallopian tube cancer, our viewers would like to know the symptoms of ovarian fallopian tube cancer.
Now, for all the viewers, unfortunately, these cancers do not have very specific symptoms. Many times patients present with variety of symptoms like abdominal bloating, indigestion, nausea, vomiting. Sometimes they feel distension of abdomen, sometimes they feel a lump in abdomen, sometimes there can be vaginal discharge. But the biggest problem is, as these symptoms are very vague and not specific to ovarian or fallopian tube cancer, majority of the times the diagnosis is delayed. So if you have these kind of symptoms which have been persistent over a period of time, I think it's a good time to meet your doctor and get these symptoms evaluated.
Okay, doctor. And doctor, is ovarian fallopian tube pain is a symptom of cancer?
No, I don't think you will have a specific pain. But if there is a big mass which is developing in the ovary or in the fallopian tube, that can give rise to kind of a dull aching pain in the lower abdomen or a dragging kind of pain in the lower abdomen. But you won't have very specific pain related to these cancers.
Alright, doctor. And doctor, are fallopian tube cysts are related to fallopian tube cancer?
No, they can be, but majority of the times the fallopian tube swelling or cyst, what we call as hydrosalpingo, are more often than not outcomes of chronic infections rather than cancer. So, if there is a fallopian tube cyst, it does not necessarily mean that there is a cancer. What it does tell is to just further evaluate.
Alright, doctor. And doctor, is fallopian tube cancer related to or same as ovarian cancer?
They are not same because they are two different organs, but they are intricately related to each other in terms of the type of cancer, in terms of the treatment that are required for this type of cancer. And nowadays the theory is proposed that all the ovarian cancers, or at least part of them, are actually originating in fallopian tube, and then those cancer cells get deposited on the ovarian surface. So for all practical purposes, as a doctor, when I am treating ovarian cancer or a fallopian tube cancer, the differentiation does not make a huge difference, because the approach to diagnosis, treatment, management and follow-up is more or less exactly the same, whether it's ovarian cancer or a fallopian tube cancer.
Alright, doctor. And doctor, how exactly is ovarian fallopian tube cancer diagnosed?
It is basically diagnosed, when patient has these kind of symptoms, and most of the time they would go to their gynecologist. The gynecologist would ask for an ultrasound and a blood test called CA125, which is a cancer marker, and either the CA125 values are elevated, or the ultrasound or sonography shows a large mass or a small mass in the ovary with suspicious features, and that's where we evaluate these patients further with certain further tests, and that's how it is diagnosed.
Okay, doctor. And doctor, where can ovarian fallopian tube cancer spread?
Yeah, either there are three types of spread that can happen. One is what we call as local spread. Second thing is what we call a spread that happens through lymphatics to the lymph nodes. And third, the spread that happens through the bloodstream to the distant organs like lungs, liver or brain. I think in ovarian cancer, majority of the times the spread is local, into the surrounding peritoneum, which is the lining of the abdominal cavity, and the surface of the abdominal organs like intestines or liver or peritoneum. It also spreads to the lymph node. The spread that happens to bloodstream happens very late in the course of ovarian cancers.
Okay, doctor. And doctor, how is ovarian fallopian tube cancer staged?
It is staging is basically understanding about how much the disease has spread. Okay, normally for majority of the cancer there are four stages. It's exactly the same for ovary or fallopian tube cancer. Stage 1, 2, 3 and 4. Stage 1 is we call when the cancer is confined to the organ of origin, in this case either ovary or fallopian tube. Stage 2 is when it spreads to the surrounding tissues like the peritoneum or the intestine or the urinary bladder, or into the surrounding tissues of ovaries or fallopian tube. Stage 3 is goes out of the pelvis and spreads to the abdominal organs like the intestines or the omentum or the lymph nodes. And stage 4 is where it spreads hematogenously to the substance of the liver or lungs or some of the other organs in the body.
So it's time for a short break now. We will be back in a few minutes. Welcome back to Narikaa Talkshow again. Moving on to our next question. Okay, doctor. And doctor, how is ovarian fallopian tube cancer treated?
Yeah, the treatment is basically dependent on the stage of the disease, the age of the patient, how is their general condition at the time of diagnosis, and surgery and chemotherapy both play a very important part in the treatment of ovary or fallopian tube cancer. Majority of the times, we do surgery first, followed by 6 cycles of chemotherapy. But in some circumstances where the tumor is widely spread and you feel surgery may not be possible, in those cases we give chemotherapy first, reduce the bulk of the disease, and then do surgery. But any patient apart from stage 1 ovarian cancer has to be mentally prepared to undergo an extensive surgery and 6 cycles of chemotherapy, and sometimes we also use what we call as maintenance therapy after the chemotherapy is over.
Okay, doctor. And doctor, how can I prevent ovarian fallopian tube cancer?
I think prevention is about, majority of these things, the lifestyle changes that we need to make. I think, fertility is important, timely fertility is important, breastfeeding of children is important, breastfeeding of kids is important, because these things protect. And there are certain things like oral contraceptive pills, which have shown to have a protective effect in terms of developing ovarian cancers.
Okay, doctor. And doctor, what is the prognosis for women with ovarian fallopian tube cancer?
Yeah, the prognosis is basically dependent on the stage of the disease. I think logically, earlier stage at which the tumor is diagnosed, the better is the prognosis. So for stage 1 has the best prognosis, stage 4 has the worst prognosis. But unfortunately, majority of the ovarian or fallopian tube cancer patients are diagnosed at stage 3, where we call the 5-year survival anywhere in the region of 35 to 50%.
Well, doctor, and when should a woman contact a healthcare provider?
I think, as I said, if you have a strong family history of breast and ovarian cancer, if you have a personal history of a breast cancer, if you have developed some vague symptoms, gastrointestinal symptoms which are persistent, or if at any point of time during your regular evaluation you are found to have an ovarian mass on ultrasound, or you feel a lump inside the abdomen, I think at any point of time you feel that there is a risk, you should be contacting the healthcare professionals.
Okay, doctor. And doctor, what are the treatment risks and the side effects of the ovarian fallopian tube cancer?
See, I think the treatment risk, nowadays the science has advanced. Okay, so there is a certain amount of risk that is associated because these are extensive surgeries. So there is about 1 to 2% risk of complications that is associated with surgery. And there are certain set of complications which are associated with chemotherapy, but majority of these complications that are associated with chemotherapy are reversible. Few of them, they do last for a longer period of time. But by and large, complication is not a major concern in these cancers.
Alright, doctor. And doctor, what changes should a woman make to protect her health?
As I said, breastfeeding the child, having fertility, eating good food, regular exercises, and understanding your own risk and being aware of the symptoms and not ignoring the symptoms. So the message is to take care of your health. Don't ignore any symptom just because they are vague gastrointestinal symptoms. Nowadays we are seeing lot younger women who are diagnosed with ovarian cancer, so nobody is protected. I think what we have to do is just stay more vigilant.
Well, doctor, and what should a person look out for signs of complications?
Complications are basically, it depends, at what level the complication. It's very difficult, to understand the signs of complication. But whenever a patient is treated, they will be on a regular checkup with their, treating medical oncologist or a surgical oncologist. And you just have to, because we keep them on a regular vigil or a regular follow-up, where any problem that happens, either because of the disease or the treatment, will be picked up.
So doctor, as you discussed about the treatment, so what is the goal of each treatment? Is it to eliminate the cancer or help a person or woman to feel better, or both?
Yeah. So I think, goal of any cancer treatment, if I have to put it in simple words, is about prolonging the survival of a patient, and number two is improving their quality of life. So for any cancer in the body, whenever we as cancer care physicians or surgeons, we are treating them, these are the two goals in mind. So all the treatment is directed towards improving overall survival of the patient and improving their quality of life. But in rare circumstances, where at the time of presentation, the disease is at a very advanced stage where it cannot be cured, then it is about prolongation of life without compromising quality of life.
And doctor, how will treatment affect the woman's personal life? Will she be able to work, exercise, or perform her usual activities?
Oh yes, absolutely. And that's what the whole aim is all about. You don't want a cancer treatment, that would restrict their activities, that would restrict their normal life, that would restrict their professional life. Obviously during the time when they are under treatment, they have to be careful. But once the treatment is complete, they can actually go back, to their daily routine activities or their professional life the way they were before starting the cancer treatment.
Alright, doctor. And doctor, could this treatment be effective for the lady to become a pregnant woman or to bear her future?
Oh, that is a little a difficult question. Okay, that is difficult in the sense, it depends on at what stage they have come. Fertility preservation is possible in certain types of ovarian cancers, especially when they come at a very, very early stage. But by and large, once the disease has spread to both the ovaries, it becomes extremely difficult. But nowadays, science is moving. It allows us to cryopreserve the ovas, the embryos. There are a lot of options, but these options are mainly restricted to women who have a specific type of histology of ovarian cancer or who present at a very, very early stage in the course of ovarian cancer.
Okay, doctor. And doctor, what type of surgery will a woman have? Will the lymph nodes be removed?
Oh, it depends on what the disease is at the time of presentation. But yes, majority of the times we do address the lymph nodes in ovarian cancer because that is one of the commonest site for metastasis in ovarian cancer. There is a lot of controversy as to how aggressive the lymph node dissection to be. And those decisions are basically taken on case-to-case basis depending on where is the disease at the time of presentation.
Okay, doctor. And doctor, what are the possible long-term effects after having this surgery?
Oh, they can have, one of the biggest problems, especially after lymph node dissection, is they can have what we call as swelling of the legs or lymphedema. Apart from that, they can have, in rare circumstances, what we call as intestinal obstruction, or they have certain incisional hernias that develop in the scar. But once they pass that initial phase, the long-term complications apart from lymphedema are very less in ovarian cancer surgeries.
Okay, doctor. And doctor, will a woman have other cancer treatment after the surgery?
Yes, in terms of, as I said, chemotherapy is an important part of the treatment. Most of the women would require chemotherapy after surgery. Then there are newer drugs like targeted therapies that are used, immunotherapies that are being used, hormonal treatments can be used. So there are a variety of treatment options that needs to be executed depending on what type of tumor the lady has and at what stage the tumor was diagnosed.
All right, doctor, and thanks a lot for.
Thank you very much.
Yeah. Okay, thank you, doctor. That was really helpful and beneficial information and views of yours. And I hope this session was really helpful for all the lovely viewers out there. So before leaving, doctor, is there anything else that you would like to share with our viewers?
Yeah, I just want all the women in this country to be taking care of their health. I think as a male in the family, what if the woman in the family is not healthy, the whole family is disturbed. The emotional health, the overall health of a family is dependent on how healthy the woman is, and unfortunately they are the element which ignore their health problems the most. So I want all the women in this country to take care of their health, be vigilant, don't hesitate to go to a doctor, and go as soon as possible or as soon as you feel the help is needed, because that can save lives. Thank you.
Well, doctor, that was really a great response, and it means really a lot to us to be with you in a Narikaa Talkshow. And thanks a lot for your precious time.
Thank you. Thanks a lot. It's my pleasure. Thank you.
Thank you, doctor. We will meet. So we will see you in another next session with another exciting topic. Until then, to all the lovely viewers, stay tuned, stay happy, stay safe.